Would everyone please be seated? Welcome to our graduates, families, and friends of the Vanderbilt University School of Medicine class of 2024. We're so pleased you could all be with us. Today we not only honor the achievements of this class, but the generous support so many of you have given our graduates along their journey. Let me begin by introducing those of us on the platform. I'm Jeff Balzer, President and CEO of Vanderbilt University Medical Center and Dean of the School of Medicine. Prior to serving as Dean, I worked here at VUSM as a cardiac anesthesiologist and critical care specialist. I'm very proud and grateful to be a 1990 graduate of this medical school. On my far right is Dr. William Cottrell, Senior Associate Dean for Undergraduate Medical Education, a pediatric critical care specialist who oversees our curriculum and will assist me in handing out the diplomas to the graduates. To his left is Dr. Consuelo Wilkins, Senior Vice President and Senior Associate Dean for Health Equity and Inclusive Excellence. She's a professor of geriatric medicine. To her left is Dr. Wright Pinson, Deputy CEO of Vanderbilt University Medical Center and our Chief Health System Officer. Dr. Pinson, a liver transplant surgeon, founded our liver transplantation program. And he's also, like me, a graduate of this medical school. To my immediate left is Dr. Donald Brady. He serves as Executive Vice Dean for Academic Affairs for the Medical School and Executive Vice President for Education and Medical Staff Affairs for the Medical Center. A general internist, he's also a graduate of our medical school, actually the same year I graduated. Dr. Brady will help hood the graduates. And to his left is Dr. Amy Fleming, Senior Associate Dean for Medical Student and Alumni Affairs. A general pediatrician, she oversees broad aspects of the student experience, including our admissions process, our wellness program, and our advisory colleges. She'll also help hood the graduates. And to her left is Dr. Barbara Gisela Carranza, Leon. She is an associate professor of medicine in the Division of Endocrinology, Diabetes, and Metabolism, an award-winning educator and clinical investigator. She was chosen by the Doctor of Medicine class to lead them in their oath of commitment. And to my far left is Dr. Jonathan Dowds, Assistant Professor of Pathology, Microbiology, and Immunology, and the recipient of the 2024 Shovel Award. This award, signifying the faculty member deemed by the students as best teacher, is the highest honor our students bestow upon a faculty member. Dr. Dowds will read the names of the graduates. Well, in keeping with Vanderbilt's tradition of celebrating our emeriti faculty, I'd like to now pay tribute to 3 faculty members from the School of Medicine who are receiving either emeritus or emeritus status at the conclusion of this academic year. These faculty serve the institution with distinction and a deep, abiding commitment to their fields. For those in attendance, please stand when I call your name, and I would ask the audience to hold your applause until all names are called. Dr. Corey Slovis, Professor of Emergency Medicine, Dr. Carl Zimmerman, Professor of Obstetrics and Gynecology, and Dr. Mary Zuter, Professor of Pathology, Microbiology, and Immunology. Congratulations to these faculty on this achievement. This academic year, the School of Medicine awarded 8 academic degrees in addition to the Doctor of Medicine. Each program is led by a distinguished specialist in the respective field who will join me on the stage in recognizing the graduates. Please stand, though, when I call your name. I would ask the audience again to hold applause until all names are called. Dr. Eric Austin, Associate Professor of Pediatrics, leads the Master of Science in Clinical Investigation. Dr. Martha Shaw-Dudak, Assistant Professor of Obstetrics and Gynecology, leads the Master of Genetic Counseling program. Dr. John G. Ely, Assistant Professor of Radiation Oncology, leads the Master of Science in Medical Physics and Doctor of Medical Physics programs. Dr. Scott D. Nelson, Assistant Professor of Biomedical Informatics, leads our Master of Science in Applied Clinical Informatics. Dr. Todd Ricketts, Professor of Hearing and Speech Sciences, leads our Doctor of Audiology, Master of Education of the Deaf, and Master of Science in Speech Language Pathology programs. And Dr. Christine Rumi, Professor of Medicine, leads the Master of Public Health program. Thank you. Now, there are also two faculty groups I want to recognize within the Doctor of Medicine program who help guide the medical students through their years of training: the college mentors and the portfolio coaches. You'll find their names listed in your programs. Our mentors greatly contribute to the professional development, it is gradual, to the professional development of each student in their learning community. Our portfolio coaches have guided the academic progress of their students in their individual career paths. We thank you all for your service to Vanderbilt and our graduates. And finally, I want to recognize all faculty members in attendance today. Those here today represent over 3,000 faculty members in our 25 departments of this School of Medicine. Students, our faculty members are dedicated to your education and are here today to celebrate with you and support you on this commencement day. Please join me in recognizing everyone who played a crucial role in this entire class's education. Thank you. Well, let's just call this what it is. It's an amazing day. It's finally your turn to sit in these chairs, wear these gowns. As a graduate of our medical school, seeing you here never fails to spark my feelings of nostalgia and a feeling of hope for the future. That hope is grounded in what we saw in you a half-decade ago when you applied to be part of this incredible community. It's also grounded in what I know you've experienced here and how you've grown as part of our community. I came to Vanderbilt as an MD PhD student, left for my residency and fellowship training, came back 8 years later, and then stayed for 25 years. I just got my 25-year rocking chair. My decision to come as a student, to come back in 1998, and then to stay so long at Vanderbilt has always been because it felt like home. See, this place, our place, it's a brilliant, creative place. But unlike some of our peers in high national rankings, we lead without sharp elbows. We see our warm, welcoming environment not as a sign of weakness, but as an abiding strength. That distinctive culture is old. It's 150 years old, and it's been handed down in a deliberate way by generations. I hope while you were here, we made you feel at home, and that you found this to be a warm and generous place, yet also a place that pushed you beyond your boundaries and knew just when to catch you if you started to fall. And I do hope you had some fun along the way. Around March, every year I start thinking about this graduation speech. This one is my 15th. Naturally, that causes me to reflect on what's going on in the world and what I'd like to hear if I were in your shoes. If I were you, I'd be thinking some about the messy, conflict-laden world you're about to launch into. These beautiful campuses that are the nation's centers of higher learning can sometimes feel like a shelter from the harsh realities of the world, but recently, our academic citadels have been less sheltered from the world's conflict. Yet the thing about conflict is it allows us to see character. In fact, I'll wager it's only during periods of stress that we really see the character of institutions. And as society surges with feelings about local events and world events, we see in these moments the character of our own people as they work and learn together. It's such people, some of whom have taught and practiced and learned here at our medical school, that I want to focus on today. I could choose many, but let's talk about Dr. Mark Dennison, one of our distinguished faculty in pediatrics and pediatric infectious disease. He's renowned around the globe for his expertise on coronaviruses like COVID-19. But that wasn't always the case. See, Mark spent decades working in relative obscurity to understand a virus no one cared about. In conversations I had with Mark 20 years ago, I remember him explaining to me this odd class of viruses could really get us into trouble someday, and bemoaning the fact that he was having a heck of a time getting the federal funding he needed to run his laboratory. Under these circumstances, many good scientists would drift away and move to a field where they could secure the funds that we all chase in academic medicine. Fast forward 20 years, in the fall of 2020, remember that? In a set of rooms behind my office where people are wearing spacesuits, Mark was there, leading much of the work to determine whether the new vaccines industry was developing were actually effective in killing COVID-19. He was leading this work because he was one of the very small number of scientists on the planet who knew how to deal with this nasty creature and test it against new drugs. I'll never forget the email he sent me one evening that fall with a picture of a titration curve. It said, "It works." It gives me chills. Mark played an outsized role in changing life for all of us, and not just because he's a brilliant scientist, but because he had the courage to persevere in hard times. You may recall when we first met, during your orientation, I told you that one reason we chose you is we believe you have the potential to not only be great physicians and great scientists, or both, but to be leaders. At Vanderbilt Medical School, we matriculate one of the nation's smallest classes, only 96 students, so we're not really going to move the numbers of the nation's physician workforce shortage. Our mission is to train the nation's healthcare leaders, and goodness knows we need them. People talk a lot about the attributes of leaders: intelligence, empathy, resilience, charisma. Courage is a leadership attribute that's mentioned less often these days. And I would argue it's underappreciated. Sometimes leaders need courage to make hard, almost impossible choices where no solution is without pain. My favorite example is a story about Winston Churchill in World War II. Few people know this story, but it's written up. At the point France was being overrun by the Nazis, the French Navy was at sea off the coast of Africa near Algeria. And the Nazis, of course, pressured what remained of the French government to return the Navy to Marseille. But Winston Churchill wanted to prevent one of the world's great navies from falling into German hands. He asked the French, very nicely, to sail their ships to British ports, or if it suited them, to American ports. The French refused, even when asked several times, and the British gave an opportunity and then an ultimatum. So Churchill ordered his navy to destroy the French fleet, and in doing so, killed 1,300 French sailors. It's called the attack on Mers el-Kabir, and it will never be forgotten. Even today, it influences French-English relations. When I was in London last year, I went to the Churchill War Bunker. If you haven't been, I highly recommend it. It's a must-see. It's a little room underneath the Treasury building where Churchill gathered the cabinet while the bombs were dropping in the road outside. They show you this armchair he sat in when he gathered the cabinet, and they show you the claw marks where he dug his fingernails into the wood of the arms. I hope you will all have a career that takes on leadership, whether in your own practice, in your institution, your local community, or at a broader level. If you do, someday you will very likely have your own stories that cause damage to your fingernails. I've had some, particularly during COVID-19. But you know, it's not always the big decisions that impact lots of people that require us to summon our courage. Over the course of your career, there will be situations that arise, often without warning, that will test your courage in a different way. In fact, for those of you about to embark on clinical training, chances are that during that period, you'll make a mistake. You'll probably make one that may cause injury to a patient. It happens to all of us during training and well beyond. Typically, when it happens, no one knows. Not your patient, not your attending, only you. And it's often the case that whether it will cause harm isn't immediately apparent. So my question is, will you say something? Most of us are filled with guilt, shame, even sometimes anger in these situations. We might try to convince ourselves that it wasn't all that bad and that it wasn't really our fault, or that maybe it won't even matter. But these experiences early in our careers put us on a path as more and more unseen opportunities to do the right thing keep coming at us. And as we take on positions of greater responsibility, the number of opportunities to do the right or wrong thing escalate. You see, I don't believe that courage is something we are born with. I think it's a learned skill. And courageous leadership is a form of professional development. Most human beings instinctively avoid the conflictual situations that demand courage. Staying out of fights may have kept us alive for a millennia before complex societies formed. I don't know about you, but I don't get up on Monday morning and think to myself, gee, you know, I feel courageous today. I think I'll go to the office and look for a conflictual and emotionally fraught situation to jump into. But summoning up the courage to engage conflict, whether to resolve a dispute in your clinic or resolve a challenging situation with a colleague, is something good leaders do. It also taps your emotional energy, and it makes you tired at the end of the day. And over time, it makes your hair fall out. One thing I think we'd all agree on, healthcare in our country is kind of a mess. Millions of people can't get access to care. Administrative waste amounts to trillions of dollars. Costs are spiraling out of control such that healthcare debt is the nation's leading cause of bankruptcy. We need courageous people in healthcare to solve everyday problems and to find solutions that are groundbreaking and tradition-defying. Why do those solutions take courage? Because embedded in that kind of innovation is a really high failure rate. See, human beings hate failure almost as much as we hate conflict. Incongruously, we need leaders in medicine with the courage to withstand individual failure. Along the way, some of your best ideas will get unfairly criticized, grants that take months to prepare will go unfunded, clinical proposals that you've pushed for years and just make sense will be ignored and struck down. But the health of your community, and for some of you, the health of our nation, will be decided by your courage at these times. Will you persevere? A lot of smart and powerful people told Mark Dennison coronavirus wasn't very important. Leadership courage plays another role that I feel compelled to mention as we say goodbye to one another. Our nation is experiencing an unfortunate escalation of incivility, And it's not just on college campuses, we're seeing it in our hospitals and clinics. Patients and family members have become less restrained in making insulting remarks to physicians, nurses, and other caregivers. And we're seeing more and more people refusing care from someone who doesn't look like them or doesn't dress like them. This is not new. It's abhorrent now as it was in the past, but the perfect storm of critical physician and nursing shortages combined with this new belligerence inflamed during the pandemic is driving away the very people we need to stay and work with us in healthcare. Well, at Vanderbilt Health, we've planted a flag, launching a mutual respect policy that states unequivocally what we will and what we won't tolerate, and what we expect our staff to do when they encounter these situations. We have screensavers and posters all over the medical center with statements like, "All people are welcome here, but all behavior is not." But the rubber really meets the road when a physician overhears a patient or family member insult or refuse care from a staff member. Graduates, your courage at these times speaks volumes and makes all the difference. In one small moment, you will shape the environment in which patients receive care and create a place where a healthcare worker feels valued, maybe even feels at home. I'll wager that care worker, that caregiver, may never forget you. Thank you for your courage, for doing all the things over so many years it took to get to this place at this auspicious moment. My sincere and heartfelt congratulations. At this time, we will begin awarding the diplomas. Will all participants in the diploma ceremony please take their places? Today, the School of Medicine will recognize graduates receiving degrees in the following degree programs: Doctor of Medicine, Doctor of Audiology, Master of Education of the Deaf, Master of Science in Speech-Language Pathology, Master of Genetic Counseling, Master of Science in Applied Clinical Informatics, Master of Science in Clinical Investigation, Master of Science in Medical Physics, and Master of Public Health. We're also recognizing 12 students who completed the requirements for a PhD while in medical school, and as well as 2 students who completed the requirements for a master's degree in business administration, 1 student who completed the requirements for a master's degree in public health, and 1 student who completed the requirements for a master's of divinity, all while in medical school. Let's begin.
Good afternoon. We will begin today with our dual degree recipients. These dual degree recipients have earned their medical degree as well as their Doctor of Philosophy degree. Dr. Jeffrey Balzer, CEO of Vanderbilt Medical Center and the Dean of the Vanderbilt School of Medicine, will present their Doctor of Medicine degree, and their PhD degrees will be presented by their mentors. Leon Yichen Kai. Leon will complete a preliminary year at Johns Hopkins Hospital and a residency in neurology at Johns Hopkins Hospital. He will also be receiving the Doctor of Philosophy degree from his mentor, Dr. Bennett Landman, Stevenson Chair, Professor, and Department Chair of Electrical and Computer Engineering, Computer Science, and Biomedical Engineering.
My friend. Thank you. Well done.
Samantha Petrillo Bike. Samantha will complete a residency in internal medicine at the University of Pittsburgh Medical Center, UPMC. She will also be receiving the Doctor of Philosophy degree from her mentor, Dr. Carlos Lopez, Principal Scientist and Lead, Multi-Scale Modeling Group, Altos Laboratories. Andrew Michael Bull. Andrew will complete a preliminary year at the University of Michigan, Ann Arbor, and a residency in ophthalmology at the University of Michigan, Ann Arbor. He will also be receiving the Doctor of Philosophy degree from his mentor, Dr. David Calkins, Professor of Ophthalmology and Visual Sciences, Dennis M. O'Day, Chair in Ophthalmology and Visual Sciences. Juan Manuel Colazo. Juan will complete a residency in orthopedic surgery at Barnes Jewish Hospital. He will also be receiving the Doctor of Philosophy degree from his mentor, Dr. Craig Duvall, Cornelius Vanderbilt Professor of Engineering, Professor of Biomedical Engineering, Professor of Chemical and Biomolecular Engineering. Charles Duncan Smart. Duncan will complete a residency in internal medicine, PSTP, at the University of Minnesota Medical School. He will also be receiving the Doctor of Philosophy degree from his mentor, Dr. Mina Medher, Division Director of Clinical Pharmacology and Associate Professor of Medicine, Indiana University School of Medicine. Ayaka Sugiura. Ayaka will complete a residency in pathology at Vanderbilt University Medical Center. She will also be receiving the Doctor of Philosophy degree from her mentor, Dr. Jeff Rathmel, Professor of Pathology, Microbiology, and Immunology, Professor of Molecular Physiology and Biophysics, Cornelius Vanderbilt Chair in Immunology. Noreen Ume Chowdhury. Noreen will complete a residency in pediatrics at the Children's Hospital of Philadelphia. She will also be receiving the Doctor of Philosophy degree from her mentor, Dr. Don Newcomb, Assistant Professor for Medicine, Assistant Professor of Pathology, Microbiology, and Immunology. Graham Walter Johnson. Graham will complete a residency in neurological surgery at the Mayo Clinic School of Graduate Education. He will also be receiving the Doctor of Philosophy degree from his mentor, Dr. Dario Englot, Assistant Professor, Neurological Surgery, Biomedical Engineering, Radiology, and Radiological Sciences. Tao Do V. Lei. Tao will complete a residency in community psychiatry at Massachusetts General Hospital. She will also be receiving the Doctor of Philosophy degree from her mentor, Dr. Julio Ayala, Associate Professor, Molecular Physiology and Biophysics. Matthew James O'Neill. Matthew will complete a residency in internal medicine at Brigham and Women's Hospital. He will also be receiving the Doctor of Philosophy degree from his mentor, Dr. Dan Roden, Department of Medicine and Pharmacology Professor, Senior Vice President, Personalized Medicine, Department of Biomedical Informatics Professor. Michael William Rudloff. Michael will complete a residency in internal medicine research at the University of North Carolina Hospitals. He will also be receiving the Doctor of Philosophy degree from his mentor, Dr. Mary Phillip, Associate Director, Institute for Infection, Immunology, and Inflammation, Assistant Professor of Medicine, Division of Hematology, Oncology. Camille Wang. Camille will complete a residency in psychiatry research at Stanford Healthcare. She will also be receiving the Doctor of Philosophy degree from her mentor, Dr. Lisa Montegia, Professor of Pharmacology, Barlow Family Director of the Vanderbilt Brain Institute. Our next set of degree recipients have earned their Doctor of Medicine degree, which will be presented by Dr. Jeffrey Balzer, CEO of Vanderbilt Medical Center and the Dean of the Vanderbilt School of Medicine. Lowell Aiden. Lowell will complete a medicine preliminary year at Meharry Metro General Hospital in Nashville, Tennessee, and then a residency in diagnostic radiology at the Mayo Clinic in Rochester, Minnesota. Sachin Kumar Agarwal. Sachin will complete a residency in internal medicine at the University of Texas Southwestern in Dallas, Texas. He is also the Founders Medalist, the highest honor awarded this year to a student in the School of Medicine. Se-Young An. Se-An will complete a surgery preliminary year, followed by a residency in interventional radiology at the University of San Francisco in San Francisco, California. Mason Nicholas Alford. Mason will complete a residency in internal medicine at Vanderbilt University Medical Center in Nashville, Tennessee. Mason is also receiving his Master of Business Administration from the Owen Graduate School of Management. Alyssa Nicole Altimer. Alyssa will complete a residency in emergency medicine at Brown University Rhode Island Hospital in Providence, Rhode Island. Anne E. Altman Marino. Annie will complete a residency in obstetrics and gynecology at Kaiser Permanente in Los Angeles, California. Malini Anand. Malini will complete a residency in orthopedic surgery at the University of California Davis Medical Center in Sacramento, California. Trevor Joseph Onesi. Trevor will complete a transitional year at Santa Clara Valley Medical Center in San Jose, California, and then a residency in physical medicine and rehabilitation at Stanford Healthcare in Stanford, California. Niall Attar. Niall will complete a residency in oral maxillofacial surgery at Vanderbilt University Medical Center in Nashville, Tennessee. Madeline Agnes Zimfer Ball. Madeline will complete a residency in urology at the University of San Francisco in San Francisco, California. Natasha Ann Belsky. Natasha will complete a residency in pediatrics at the Children's Hospital of Philadelphia in Philadelphia, Pennsylvania. Gabriel Alexander Benfeld. Gabriel will complete a residency in neurological surgery at the Mayo Clinic in Jacksonville, Florida. Akshay Bamidipati. Akshay will complete a surgery preliminary year at Vanderbilt University Medical Center in Nashville, Tennessee. Julia Christine Bullanen. Julia will complete a residency in family medicine at Mountain Area Health Education Center in Asheville, North Carolina. Stephen Bichet. Stephen will complete a residency in diagnostic radiology at the Mayo Clinic in Phoenix, Arizona. Alexandria Marie Bontrager. Alex will complete a residency in general surgery at Vanderbilt University Medical Center in Nashville, Tennessee. Kayla Atessa Badafuco. Kayla will complete a residency in medicine and pediatrics at Vanderbilt University Medical Center in Nashville, Tennessee. Calvin Cable. Calvin will complete a residency in pediatrics at Vanderbilt University Medical Center in Nashville, Tennessee. Shravika Lam Chenapati. Shravi will complete a surgery preliminary year, followed by a residency in ophthalmology at Vanderbilt University Medical Center in Nashville, Tennessee. Sarah Ann Cook. Sarah will complete a residency in medicine and pediatrics at Vanderbilt University Medical Center in Nashville, Tennessee. Nina Bulat Churkovich. Nina will complete a medicine preliminary year, followed by a residency in dermatology at the University of Texas Southwestern in Dallas, Texas. Rishabh Curran Das. Rishabh will complete a surgery preliminary year at Vanderbilt University Medical Center in Nashville, Tennessee. Veera Venkata Naga Manohar Devrasetti. Veera Venkata Naga Manohar will complete a residency in orthopedic surgery at Carolinas Medical Center in Charlotte, North Carolina. Melissa Dong. Melissa will complete a residency in internal medicine and psychiatry at the University of Texas Southwestern in Dallas, Texas. Patrick Waldron Doyle. Patrick will complete a surgery preliminary year, followed by a residency in interventional radiology at Vanderbilt University Medical Center in Nashville, Tennessee. Ashley Chantal Drengler. Ashley will complete a residency in internal medicine at Vanderbilt University Medical Center in Nashville, Tennessee. Chenbo Feng. Chenbo will complete a residency in family medicine at HCA Midwest Health in Kansas City, Missouri. Zoe Feiner. Zoe will complete a residency in internal medicine at Vanderbilt University Medical Center in Nashville, Tennessee. Desmond Shavas Garner. Desmond will complete a residency in otolaryngology at Northwestern University McCall Medical Center in Chicago, Illinois. Rachel Saviera Goodman. Rachel will complete a transitional year at HCA Healthcare TriStar in Nashville, Tennessee, and a residency in dermatology at Yale New Haven Hospital in New Haven, Connecticut. Isaac Gorgie. Isaac will complete a residency in internal medicine at the University of Southern California in Los Angeles, California. Riley John Gay. Riley will complete a residency in emergency medicine at the University of Cincinnati Medical Center in Cincinnati, Ohio. Kevin Guo. Kevin will complete a residency in anesthesiology at the University of Washington Affiliated Hospitals in Seattle, Washington. Jessica Lindsay Dawn Hanks. Jessica will complete a residency in pediatrics at Vanderbilt University Medical Center in Nashville, Tennessee. Lauren Ashley Lambert Hatcher. Lauren will complete a transitional year at HCA Healthcare TriStar in Nashville, Tennessee, and a residency in diagnostic radiology at Vanderbilt University Medical Center in Nashville, Tennessee. Lauren is also receiving her Master of Business Administration today from the Owen Graduate School of Management. William Franklin Heffley III. Will complete a residency in orthopedic surgery at Vanderbilt University Medical Center in Nashville, Tennessee. Anna Catherine Aruni Hendricks. Anna will complete a residency in pediatrics at the University of Texas Southwestern in Dallas, Texas. Hannah Christine Hund. Hannah will complete a surgery preliminary year at Vanderbilt University Medical Center and a residency in interventional radiology at the University of California, San Diego Medical Center in San Diego, California. Casey Lee Hutchinson. Casey will complete a residency in pediatrics at the Children's Hospital of Philadelphia in Philadelphia, Pennsylvania. Jacob Junsung Jo. Jacob will complete a residency in neurological surgery at Johns Hopkins Hospital in Baltimore, Maryland. Joel Timothy Johnson. Joel will complete a residency in anesthesiology at the University of Washington Affiliated Hospitals in Seattle, Washington. Singyan Jung. Singyan will be moving to New York City to pursue a career in finance. Caroline Bennett Kana. Caroline will complete a residency in obstetrics and gynecology at the University of Pittsburgh Medical Center in Pittsburgh, Pennsylvania. Stefan Wolfgang Koester. Stefan will complete a residency in neurological surgery at Barrow Neurological Institute in Phoenix, Arizona. Shreyas Govindaranga Krishnapura. Shreyas will complete a residency in otolaryngology at the University of Cincinnati Medical Center in Cincinnati, Ohio. Diane Louise Sung Lee. Diane will complete a residency in otolaryngology at the University of Michigan Hospital in Ann Arbor, Michigan. Lena Eve Leshinsky. Lena will complete a residency in general surgery at Vanderbilt University Medical Center in Nashville, Tennessee. Andrea Na Lee. Andrea will complete a residency in urology at the University of Michigan Hospital in Ann Arbor, Michigan. Hannah Louise Light Olson. Hannah will complete a residency in obstetrics and gynecology at the University of California, San Francisco in San Francisco, California. Andrea Alejandra Lopez. Andrea will complete a residency in otolaryngology at Vanderbilt University Medical Center in Nashville, Tennessee. Gabrielle Colleen Lyons. Gabriel will be pursuing a career focused on public health. This summer, she will be moving to Chicago to start a role as a consultant advising healthcare and public health organizations. Gabrielle is also receiving her Master of Public Health degree today from the Vanderbilt School of Medicine. Eden Marie Lyons. Eden will complete a transitional year at HCA Healthcare TriStar in Nashville, Tennessee, and a residency in dermatology at the University of Southern California in Los Angeles, California. Anna Elizabeth Matthews. Anna will complete a residency in emergency medicine at the University of California, San Francisco in San Francisco, California. Matthew Medhap Mikal. Matthew will complete a residency in urology at the University of Southern California in Los Angeles, California. Alexandra Kristen Miller. Alex will complete a residency in physical medicine and rehabilitation at Vanderbilt University Medical Center in Nashville, Tennessee. Gloria Nashed Mina. Gloria will complete a residency in anesthesiology at Baylor College of Medicine in Houston, Texas. Dominique Alyssa Mosley. Dominique will complete a residency in internal medicine at Emory University in Atlanta, Georgia. Emma Holman Neal. Emma will complete a transitional year at HCA Healthcare TriStar in Nashville, Tennessee, and a residency in diagnostic radiology at Vanderbilt University Medical Center in Nashville, Tennessee. Matthew Nettles. Matt will complete a residency in psychiatry at Vanderbilt University Medical Center in Nashville, Tennessee. Matt is also receiving his Master of Theological Studies degree today from the Vanderbilt Divinity School. Michael Thomas O'Brien. Michael will complete a residency in internal medicine at Vanderbilt University Medical Center in Nashville, Tennessee. Caitlin Christine O'Leary. Katie will complete a residency in family medicine at Womack Army Medical Center in Fort Liberty, North Carolina. Sarah Janet Wada. Sarah will complete a transitional year at Scripps Mercy Hospital in San Diego, California, and a residency in anesthesiology at the University of California, San Diego Medical Center in San Diego, California. Tristan Anthony Ponzo. Tristan will complete a medicine preliminary year and a residency in neurology at Northwestern McGaw Hospital in Chicago, Illinois. Peter Thomas Potash. Peter will complete a residency in medicine and pediatrics at Vanderbilt University Medical Center in Nashville, Tennessee. Jaron Kai Pruitt. Jaron will complete a residency in ophthalmology at Wake Forest University in Winston-Salem, North Carolina. Daniel Kirillos Ragib.
That's my brother!
Danny will complete a residency in thoracic surgery at the Cleveland Clinic in Cleveland, Ohio. Saba Ruman. Saba will complete a residency in internal medicine at Vanderbilt University Medical Center in Nashville, Tennessee. Robert Rodriguez Suro. Robert will complete a residency in psychiatry at Vanderbilt University Medical Center in Nashville, Tennessee. Kyle Logan Schwartz. Kyle will complete a transitional year at Health Education Services in Tucson, Arizona, and a residency in Santa Barbara, California. Georgina Elise Sellen. Georgina will complete a medicine preliminary year, followed by a residency in dermatology at Vanderbilt University Medical Center in Nashville, Tennessee. Ananya Sharma. Ananya will complete a residency in internal medicine at the University of Pittsburgh Medical Center in Pittsburgh, Pennsylvania. Samantha Alexis Single. Samantha will complete a residency in family medicine at Long Beach Memorial Medical Center in Long Beach, California. Adam Joseph Stark. Adam will complete a residency in psychiatry at the Brigham and Women's Hospital in Boston, Massachusetts. Harrison Campbell Thomas. Harrison will complete a residency in plastic surgery at MedStar Georgetown University Hospital in Washington, D.C. Noah Jeremiah Thompson Orfield. Noah will complete a transitional year at HCA Healthcare TriStar in Nashville, Tennessee, and a residency in diagnostic radiology at the University of Virginia in Charlottesville, Virginia. Asim Utrankar. Asim will complete a residency in internal medicine at Vanderbilt University Medical Center in Nashville, Tennessee. Praveen Vimalatas. Praveen will complete a residency in general surgery at Vanderbilt University Medical Center in Nashville, Tennessee. Vicky Eating Wang. Vicky will complete a residency in psychiatry at Oregon Health and Science University in Portland, Oregon. Amber Nicole Wesolowski. Amber will complete a residency in anesthesiology at Vanderbilt University Medical Center in Nashville, Tennessee. Allison Christine Wyman. Allie will complete a residency in neurology at Vanderbilt University Medical Center in Nashville, Tennessee. Mingray Zhu. Mingray will complete a transitional year at the University of Maryland in Baltimore, Maryland, and a residency in anesthesiology at the University of California, San Francisco in San Francisco, California. Enon Zhang. Enon will complete a transitional year at Capitol Health Regional Medical Center in Pennington, New Jersey, and a residency in diagnostic radiology at the Hospital of the University of Pennsylvania in Philadelphia, Pennsylvania. The Department of Hearing and Speech Sciences degrees will be represented on stage by Dr. Todd Ricketts, Vice Chair of Graduate Studies, and the Thomas L. and Jane Wilkerson Yount Chair in Hearing and Speech Sciences. We will begin with the graduates who have earned their Doctor of Audiology degree. Rachel Tamar Harchins. Rachel completed an externship at Vanderbilt University Medical Center, Nashville, Tennessee, and is planning a career in pediatric and educational audiology. Jane Doreen Hulse. Jane completed an externship at the University of Pittsburgh Medical Center in Pittsburgh, Pennsylvania, and is planning to work at the University of Pittsburgh Medical Center, St. Margaret. Karina Joanne Jurek. Karina completed an externship at Boston Children's Hospital in Boston, Massachusetts, and is planning a career in pediatric audiology. Megan Page Lee. Megan completed an externship at the Veteran Affairs Tennessee Valley Healthcare System in Nashville, Tennessee, and is planning a career in adult diagnostics, amplification, and implantable devices. Mackenzie Ann Leiterink. Mackenzie completed an externship at Vanderbilt University Medical Center in Nashville, Tennessee, and is planning a career in hearing and language research and will be staying at Vanderbilt to complete a PhD. Kaylee Lynn McDonald. Kaylee completed an externship at Vanderbilt University Medical Center in Nashville, Tennessee, and is planning a career in adult amplification and vestibular diagnostics and treatment. Catherine Noel Nunez. Catherine completed an externship at the Sacramento Ear, Nose, and Throat in Sacramento, California, and is planning to work at Sacramento Ear, Nose, and Throat in Sacramento, California. Kaylee Renee Pletch. Kaylee completed an externship at Oregon Health and Sciences University in Portland, Oregon, and is planning a career in pediatric diagnostics and rehabilitation. Amanda Lee Wassoff. Amanda completed an externship at Vanderbilt University Medical Center in Nashville, Tennessee, and is planning a career in vestibular evaluation and treatment, as well as adult diagnostics and amplification. Laura Elizabeth White. Laura completed an externship at the Connecticut VA Medical Center in West Haven, Connecticut, and is planning a career in adult amplification and diagnostics. The following graduates have earned their Master of Education of the Deaf degree and will also be represented by Dr. Ricketts. Catherine Madden. Catherine completed a Maymester at Longview Elementary School in Spring Hill, Tennessee, and is planning a career in early intervention and education for students with hearing loss. Melissa Patino Gonzalez. Melissa completed a Maymester at Metro Nashville Public Schools in Nashville, Tennessee, and is planning a career in deaf education. Audrey Marissa White. Audrey completed a Maymester at the Tennessee School for the Deaf in Nashville, Tennessee, and is working as a deaf education pre-kindergarten teacher. The following graduates have earned their Master of Science in Speech-Language Pathology and will also be represented by Dr. Ricketts. Juliana Nicole Alexander. Juliana completed an externship at the University of Birmingham Hospital Women and Infants Center in Birmingham, Alabama, and is planning a career in early childhood intervention. Abigail Barnes. Abigail completed an externship at High Hopes Development Center in Franklin, Tennessee, and is planning a career in school-based and outpatient care. Allison Michelle Byerly. Allison completed an externship at the Elvin C. York Veterans Administration's Medical Center in Murfreesboro, Tennessee, and is planning to complete a certification fellowship year at San Francisco Bay Area Public Schools. Annabelle Jane Clark. Annabelle completed an externship at Williamson County Schools in Brentwood, Tennessee, and is planning a career in the Tennessee school system. Lucy Manning Cochran. Lucy completed an externship at Ross Early Learning Center in Nashville, Tennessee, and is planning a career in the North Carolina school system. Megan Elizabeth Dillon. Megan completed an externship at Granbury Elementary School in Brentwood, Tennessee, and is planning a career in speech-language pathology. Tess Ellis. Tess completed an externship at UC Davis Medical Center in Sacramento, California, and is planning to complete a certification fellowship year at Tampa General Hospital in adult acute care. Rebecca Hannah Greenstein. Rebecca completed an externship at Hasbro Children's Hospital in Providence, Rhode Island, and is planning a career in acute care. Thalia Elizabeth Irwin. Thalia completed an externship at Golisano Children's Hospital, Rochester in New York, and is planning a career in pediatric intervention, working with children with autism and developmental disabilities. Erin Marie Kerwin. Erin completed an externship at Children's Health in Dallas, Texas, and is planning a career in acute care. Daphne Bishaka Colstow. Daphne completed an externship at Fort Worth Independent District, Fort Worth, Texas, and is planning a career in pediatric hearing loss. Jessica Faith Kransdorf. Jessica completed an externship at Memorial Sloan Kettering Cancer Center in New York City and is planning a career in acute care. Raina Lee Lynch. Raina completed an externship at Shirley Ryan Ability Lab Northbrook Outpatient Center in Northbrook, Illinois, and is planning to complete a certification fellowship year at an acute care placement. Kaylee Lynn Matthews. Kaylee completed an externship at Vanderbilt University with the Pediatric Medical SLP Outpatient Team in Nashville, Tennessee, and is planning a career in speech and language intervention and evaluation for pediatric clients. Danny Hope Pereira. Danielle completed an externship at Children's Hospital of Colorado in Aurora, Colorado, and is planning a career in medical speech pathology. Tabitha Grace Reed. Tabitha completed an externship at Select Specialty Hospital in Nashville, Tennessee, and is planning to complete a certification fellowship year. Alexandra Jane Stanley. Alexandra completed an externship at Graceful Words Private Practice in Clarksville, Tennessee, and West Cheatham Elementary School in Chapmansboro, Tennessee, and is planning a career in speech pathology, working with children with complex communication disorders. Elise Sy. Elise completed an externship at the Nashville VA Medical Center in Nashville, Tennessee, and is planning to complete a certification fellowship year at UW Health Adult Acute Care and the University of Wisconsin-Madison School of Medicine in Madison, Wisconsin. The following graduates have earned their Master of Genetic Counseling degree and will be represented on stage by Dr. Martha Dudek, Director of the Master of Genetic Counseling Program. Michaela Ray Bradley. Michaela is looking forward to starting her professional career as a genetic counselor. She is passionate about working with pediatric patients and hopes to incorporate teaching into her work. Serena Lynn Fleming. Serena is looking forward to starting her professional career as a genetic counselor. She is passionate about advocacy, equity, and neurogenetics. Mary Aylin Hurley. Mary is looking forward to returning to Rhode Island and spending time with her loved ones while studying for the boards. She is passionate about service delivery models and finding innovative ways to alleviate barriers to genetic counseling services. Cecilia May Kessler. Cecilia will be joining the Inherited Retinal Disease team at Vanderbilt while completing the Advanced Research Training for Genetic Counselors Certification Program. She is passionate about healthcare accessibility and advocacy. Joan Kornkoven. Joan is looking forward to returning to her home state of Minnesota and beginning her professional career as a genetic counselor. She is passionate about advocacy and policy for rare diseases. McKenna Ashton Martin. McKenna will be joining the cancer genetics team at the Cleveland Clinic in Cleveland, Ohio. She is passionate about advocacy and equity in healthcare. Leanna Domenica Paul. Leanna is looking forward to be staying at Vanderbilt to continue research by participating in the Advanced Research Training for Genetic Counselors Certificate Program through the University of Pennsylvania. She is passionate about reproductive genetics and developing innovative approaches to genetic diagnosis. The following graduates have earned their Master of Science in Applied Clinical Informatics degrees and will be represented on stage by Dr. Scott Nelson, Director of the Applied Clinical Informatics Program. Julie Ann Bummel. Julie is excited to use her MS-ACI experience to drive further workflow enhancements for physicians, especially reimagining the radiology PACs into a more portable, flexible, and human-friendly interface. The following graduates have earned their Master of Science in Clinical Investigations degree and will be represented on stage by Dr. Eric Austin, Director of the Master of Science in Clinical Investigation program. Sylvia Linear Groth. Dr. Groth, an ophthalmologist and glaucoma subspecialist, has focused her research on test-retest variability and virtual reality perimetry in adults with glaucoma and healthy controls, and establishing a lower IOP threshold in eyes with uveitis and glaucoma. Dr. Groth plans to continue her research as an associate professor of ophthalmology and visual sciences here at Vanderbilt University Medical Center. Sachin Paranjpe. Sachin, a research scientist and recipient of the Vivian Thomas Award for Excellence in Clinical Research, has research focused on orthostatic intolerance after bariatric surgery. With nearly 30 years of service, Sachin is at the Autonomic Dysfunction Center at Vanderbilt Medical Center under the mentorship of Drs. Italo Biagiani and Cynthia Chabot. Jefferson L. Triozzi. Dr. Triozzi is a nephrologist studying the harmful effects of metabolic disease and obesity on the kidneys under the mentorship of Dr. Adriana M. Hung. He will join the Vanderbilt University Medical Center faculty as a clinical instructor within the Division of Nephrology and Hypertension to continue his research and clinical care. The following graduates have earned their Master of Science in Medical Physics degree and will be represented on stage by Dr. John Ely, Director of Medical Physics Education Program. James Raymond Burns. James will be joining the Medical Physics Residency Program at Vanderbilt University Medical Center. Corey Lynn Burrows. Corey will be joining the Radiation Oncology team at Novant Health Cancer Institute as a medical physics resident. The following graduates have earned their Master of Public Health degree and will be represented on stage by Dr. Christian Rumi, Director of the Master of Public Health program. Anjurla Ulawa Abisurla Ajayi. For her thesis, Anjula worked with her mentor, Sarah Osmundson, on a project titled Use of Hydroxyprogesterone in Pregnancy and the Risk of Recurrent Preterm Birth, a nested case control study. Nicole Reinhold Anderson. Nicole worked with her mentor, Stephen Patrick, to research weight loss in prenatally opioid-exposed neonates with additional withdrawal exacerbating exposures for her thesis. Nicholas Brent Baker. Working alongside mentor John Graves, Nick's thesis research investigated the variability in hospital organ donation performance in the United States. Camden Amy Castagna McLeod. Camden worked with mentors Carlos Grijalva and Kip Talbot to study the effect of infectors' age and gender on influenza transmission risk. Kara Elizabeth Charnogurski. For her thesis, Kara worked with mentors Lee Howard and Carlos Grijalva on pandemic social distancing and declines in nasopharyngeal carriage of pneumococcus and related antimicrobial resistant genes, evidence from household-based cohort studies in Lima, Peru. Paul Vinay Raj Chekuri. As part of his MPH training, Paul pursued a capstone project called The Impact of the Firefly Program, how the partnership between VUMC, TennCare, and CMS improved quality of care for pregnant and postpartum women with opioid use disorder and their infants in Middle Tennessee. Genevieve Elizabeth Delano. Genevieve worked with her mentor Peter Ribeiro on her thesis research titled COVID-19 Vaccination Among People Living with Diagnosed HIV in Tennessee. Gianna Ferreira. Gianna's thesis focused on associations between household second smoke exposure in the first year of life and subsequent recurrent wheezing and asthma diagnosis in childhood. Her research was mentored by Brittany Cinder. Catherine Evelyn Griffin. For her thesis, Katie worked with mentor Christiane Rumi on a project titled Evaluating the Association of SGLT2I on Amputation, Stent Placement, or Vascular Surgery compared to DPP4 as an add-on therapy, a cohort study in veterans with diabetes. Brittany Nicole Gutierrez Kiddo. Brittany pursued a capstone project called Community Development, designing and implementing a power mapping program with mentor Abrani Jones. Ola Riyad Hamdan. Ola completed her thesis under the guidance of mentor Natasha Halassa. Her research examined influenza-specific antiviral use in hospitalized children before and during the COVID-19 pandemic, new vaccine surveillance between 2016 and 2023. Corianne Renee Johnson. Corianne's thesis focused on the influence of residential segregation, urbanicity, and population density on hepatocellular carcinoma incidence among a low socioeconomic population, with mentor Stacy Sudenga. Brittany Jean Layer. For her thesis research, Brittany conducted a statewide assessment of the appropriateness of pediatric outpatient antibiotics with mentor Sophie Katz. Alexandra Standish Lippum. Lexi's thesis looked at the impact of state abortion restrictions implemented between 2010 and 2020 on state-level food insecurity under the mentorship of Carrie Fry. Tevin Sabu Matthew. Tevin worked with Primeros Passos for his practicum and pursued a practicum on advancing equity through empowerment, identifying barriers to paternal engagement, and increasing awareness of child malnutrition in rural Guatemala. Grace Evelyn Ratcliffe. Grace's capstone project focused on policy and program evaluation, examining the impacts of preventative health measures on community well-being. Mentor Stacy Pasenka guided her work on this project. Stacy Lynn Riddick. For her capstone, Stacy worked with mentor Leslie Boone on understanding the impact of community engagement on health equity research. Miriam Ali Saad. Under the mentorship of David Stevenson, Miriam researched surgical revision rates following breast reconstruction for breast cancer across payer type for her thesis. Caleb Hurst Wolf. Caleb received mentorship from Romney Humphreys on his thesis research titled assessing antimicrobial susceptibility test breakpoint use in Tennessee. Joshua Shane Woods. Josh's thesis examined information needs of rural and Black Tennesseans eligible for inherited cancer genetic testing, qualitatively informed policy. Maya Robertson served as his mentor for this work. Lauren Elizabeth Zalesky. Guided by mentor Kevin Griffith, Lauren completed her thesis on differences in healthcare usage, access, and quality between English and Spanish-speaking children. And now, please join me in congratulating all of our graduates.
A well-recognized tradition of medicine is the taking of an oath, usually a variation of the Hippocratic Oath, representing a physician's commitment to their patients and colleagues. Our Doctor of Medicine graduates have written an original oath giving special meaning to this tradition. They invite you, their teachers, family, and friends to listen closely to its words and to hold them accountable for its ideals. The class of 2024 asked Dr. Carranza Leon to lead them in the oath.
Will the Doctor of Medicine graduates please stand for the taking of the oath? I will now recite the oath in segments and ask the graduates to repeat each segment after me. With gratitude for the privilege and responsibility of becoming a physician, I pledge this oath to myself, my patients, my colleagues, and my community, to safeguard the well-being and trust of my patients, empowering their agency in living and dying, to be ever mindful of my capacity to do harm, and of my duty to prevent it whenever possible. To meet my success with humility. And my failures with resilience. To learn continuously. Teach generously. Collaborate intentionally. And lead selflessly. To care for myself and my colleagues. As I do for my patients. To be an active member of my communities. advocating for equity, and opposing injustice, to serve with compassion, joy and integrity, upholding the unique promises and commitments I carry. Together as a class, we vow to live out this oath to the best of our abilities from this day forward. Congratulations, you may be seated.
Congratulations to our MD graduates. You're now, and as long as you live, physicians. Most importantly, you are Vanderbilt physicians. I trust you'll bear that honor with pride, but also humility and a profound sense of responsibility. To all of our graduates, may your leadership be transformative, whether caring for patients or working as an educator, an administrator, or an investigator, bringing new hope and satisfaction and opportunity to your patients, your friends, and your colleagues. I would like to thank Medical Student Affairs, Dean Brady and Dean Fleming, for all the work they do behind the scenes to make this commencement week so special. I'll now ask Dr. Suba Rahman, Doctor of Medicine class president, to come forward, retrieve the school standard, and lead all of our graduates in the recessional. And would all guests please stand and remain in place until the recessional of the graduates and the faculty is complete.